Dr Ahmad Abbadi, welcome and thank you for taking time at this World Conference on Tobacco Control to speak with Ash Scotland.
Thank you for having me.
Oh, you're so welcome. How are you finding the conference and what are the benefits of being here?
Well, the conference was really amazing. On one hand, I managed to network again after many years, not able to see anyone, and be able to connect with people you knew, connect with people that now you are becoming good friends with and trying to collaborate together with. But also I think one of the nice things about it is you get to hear other people's perspectives and opinions. And yes, we might have varying opinions on how we should address a certain tobacco control topic, but the nice thing is we all have the same North Star and we're all working towards that. So as long as we keep that in front of us, we can collaborate together and our differences then become strength that carries us forward.
Yes.
So, yeah.
Absolutely. And you were presenting at the conference. What were you presenting on?
Yes, so there were two topics we've discussed. One is the industry interference in Jordan and the governmental response. And one of the things we try to highlight is the industry is so vigilant in trying to do so many different things within the country. But at the same time, people need to be alert of what's going on. And it's important for civil society organizations and the Ministry of Health and intergovernmental organizations to work together to do proper mapping. And the mapping shouldn't be just relying on some forms of evidence. It needs to be very scientific and rigor, because when you do it in that way, you get proper evidence that you can use then to inform policymakers. And that's what we saw in Jordan. Many of the recommendations we have put on the table, they are implementing slowly, but they are for surely implementing. And that was one good thing. The other thing we show is we did a review of all of the 189 signatories or parties to the FCTC, and we looked how they define tobacco products and nicotinic products, nicotine, tobacco, and other things. And in this specific abstract, we focused only on tobacco products, but we found that it really varies among countries. And it's not just that they vary when what kind of things they include as tobacco product, but over time they also are changing things. And with the emergence and re-emergence of nicotinic and tobacco products, we need to be very vigilant on what kind of things are put now in the market, but what will be later on in the market. And that is very important just to pay attention to.
Yes. In Scotland, we are seeing the emergence of a range of recreational nicotine products that are appealing to children and young people. Are you seeing anything like that in Jordan?
Absolutely, absolutely. I have to say this goes from a decade back, and e-cigarettes were so popular in vape among youth and teens, but now we also, because unfortunately it got legalized, so heated tobacco products are also on the market. And although now it's still not the issue in Jordan, but Saudi Arabia, for example, has now a factory for nicotine pouches. And it's just a matter of time, until we have nicotine pouches coming in. And that creates a whole environment. When you have so many products, it's very hard to catch, and they look in different shapes, different colors. So it's hard to even to identify that this is a nicotinic product or a tobacco product. So we're facing the same issues, unfortunately, that the rest of the globe is facing.
Yes, definitely. So what's good about what's happening in Jordan in terms of this area of work?
So in Jordan we have, I think our biggest success is the strong collaboration between civil society among themselves, and also civil society with the Ministry of Health.
Yeah.
And this has not been built over a day. It was a long number of years, working hard, putting hours, disagreeing, then agreeing, then disagreeing, then agreeing again. But what matters is that we have a belief that really we want to do something for the people. We care about the health of the people, and that's a driving force for all of us to work together. And the latest, I would say, success is having the National Tobacco Control Strategy 2024-2030 passed, that include the top provisions that other countries want to implement, from plain packaging to all the way to having more awareness about industry interference and having the index as one of the indicators in it, to awareness, to taxes, to harmonizing taxes. So it was fantastic to see this achievement, and it only occurred because we all sat on the table together, discussed for such like long time, then reached something we felt this is something that represents all of us.
Yes, congratulations on that.
Thank you.
I think in the UK we are still having discussions that are different perspectives. From outside the UK, is
Yeah.
there anything you'd like to comment on that Ash Scotland should be aware of in our work?
Absolutely. I think you're doing first fantastic work. Really appreciate it across the globe. When you share the intelligence, you shared with us articles, updates on the GATC server list, but also in general, that is highly appreciated and welcome. And so I have to tell you that. But I also think that you are now going towards the end game in the UK. And although it's a very important step that the whole globe will be looking at, it's important to pay attention to what are the provisions that will define the end game. And what do you define as the product that you're going to prohibit? Because the thing is, the industry is always going to be 2 steps ahead of us, and the legislation process takes a long time. So you need to have a text that is flexible enough that allows you to protect the youth and the future generations from whatever the industry wants. And one of the things, for example, we've heard during the conference is a whitelist. These are the things that are allowed. Anything beyond that, absolutely forbidden. So shifting the narrative from things are immediately approved to not approved. And that's already being implemented by pharma. When, as a medical doctor, I want to treat a patient, if it's not evidence-based, if it's not in the guidelines, I can face jail for doing something that is against the medical recommendations. So it does exist. It's not we're inventing the wheel is there. We need to just borrow it from another sector and use it here in tobacco control.
I think that's a brilliant idea. I've seen it tried in France with alcohol. They said, these things are allowed, you have to get permission for anything different.
Exactly.
So really helpful. Is there anything else that you'd like to tell us about before I finish?
No, I just want to say you and your team really deserve a big thank you for all of your work. And it's fantastic to get to know you more during the conference and all of your team. And I think it's just lovely that we get to meet, we get to talk, but also hopefully collaborate more in the future.
For sure.
Thank you.
Thank you, and it's been brilliant meeting you, meeting your colleagues. Thank you for the inspirational thoughts that you've shared with us today.
Thank you. Thank you so much. Appreciate it.